Hi guys, today we'll discuss about petrol consumption patient. So when patient came with the complaining of consumption of petrol, so what I have to do and what are the complications it will offer, what is the first aid, we'll discuss. So whenever the patient came with the history of consumption of petrol, so first we'll discuss what is petrol. So our medical side for the treatment purpose we have to consider this petrol, diesel and sanitizer and some kerosene, so these all things etc to be considered as an corrosive. So these are very irritant to the skin and the mucous membrane also. So what you have to do is, with this whatever the complications occur that we have to see. So first, if any patient came with history of this consumption, so what you have to do is we have to see first whether this patient consumed or not and how much quantity, so at what time and when. So is it too late to come to the hospital, and is it they have are they come early to the hospital? You have to keep it in mind. One more thing is patient had vomited or not. One third one is, one more is, patient is this patient is conscious or not, and this patient is, if that patient took with alcohol. So these all things to be considered. So I'm not discussing about that medical legal part. So medical legal part to be done, so MLC to be sent to the police station to rule out their causes and whatever, though that is apart. So what I want to discuss is, what you have to do is, in the first aid, if you found any patient took an alcohol, first you should not try her to vomiting. If the patient, some patient in a local area, if the patient someone got vomiting, like someone got poison, they, if they consume the poison means they will put some salt water and they will try to vomit because of this condition. So in this patient, in this kerosene, whatever the corrosive actions like petrol, diesel, sanitizer and the spirit bottles and then kerosene, so if the patient consume all these things, we should not try to do the vomiting. So it is very why you should not to try to do vomiting. When patient trying to do vomiting, if there may be a chances of aspiration pneumonia, that's why you should not do. So both trachea and esophagus here only. So when the patient is vomiting, their vomitus may goes to the trachea and may form pneumonia. So this, because of this condition, so it is called an aspiration pneumonia. So this aspiration pneumonia, aspirant is that petrol. That's why it is called as corrosive. Like chemical pneumonia maybe have occur. So this is one. One more thing is, what you have to do if the patient hospital, like there are some controversies. If the patient came and he lie on the bed, so first aid we have try to like get an IV line and we are giving injection. So one question come here is whether to put RT or not in this patient. So RT, Riles tube, it is to for the stomach wash. So stomach wash is, some told that stomach wash is strictly contraindicated in the petrol and all the kerosene. So some tell that no, it is not a strictly contraindicated if the patient is conscious. So we have to put RT slowly by giving some antiemetics so that it will prevent aspiration pneumonia. By giving antiemetics, we have to put RT slowly so that immediately whatever the content is there, we have to remove with the stomach wash. So this is for according to our, like my thinking. So if the I have practiced so many things, because uh, we have to think whatever if the patient came within 1 hour or within 20-30 minutes to the hospital, we have to put RT, because we don't know that aspiration, like if the patient is that petrol or whatever, if they stays in the stomach, there may be chances of aspiration, the patient may vomit. That's why by putting immediately RT, so we have removed the everything from the stomach. So good stomach wash can prevent all these complications. So I think. And one more thing is, if the patient had consumed that petrol or whatever, if it is came late to the hospital, so what you have to do, if it is came late to the hospital, so there will be no stresses in that petrol or any corrosive, that will not be stasis in the stomach. So then there is no use of this all these things. Okay, that's why if you do in that time, it will never help, because that's why you should not give put RT if the patient consume petrol and came late to the hospital, minimum 4 to 6 hours. So that's why these two things to be keep it in mind. One more thing is, we have to give an antibiotics so that to prevent secondary pneumonia or chemical pneumonia. And if the patient, we have to check airway, breathing, circulation and disability. If the patient is having good airway and there is a no proper no improper in the circulation, no any problem in all this ABCD, you should not think too much, because only thing is patient should not vomit, patient may get an aspiration pneumonia, and patient may some fever chills episodes. That's why what you have to do is we have to give some antiemetics and antibiotics to prevent secondary pneumonia. And one more thing is we have to take investigation chest x-ray to be taken to rule out whether any pneumonia features, chemical pneumonia features. That's why this is very common in villages side. If the patient any of the like any patient consumed anything, means they will first give some salt water and they will try to vomit. So it is okay if the patient is conscious and everything, home test may come back. If the patient is unconscious, you should not do this, because there may be chances. One more thing is if the patient is in the hospitalization area, just let them to the doctors. So this is the main thing. And if